guys. Today's case is of a 24-year-old female patient who is having a significant expansile radiolucent lesion within the posterior right mandible and ramus. So the lesion is involving the right mandible at the molar region and further it extending within the ramus. Within the ramus, you can say it's involving the anterior half as well as the inferior half of the ramus. I'll show you with the help of the cursor. As you can see, the cursor moving on to the anterior half and now it's moving to the inferior half of the ramus. Since the lesion has caused significant expansion, so we'll see the inferior mandibular cortex which has been expanded and resulting in significant thinning and partially dehiscence of the cortex. Apart from the inferior mandibular cortex, the buccal and lingual cortices are also involved here. So if we first talk about the lingual cortex, it's exhibiting significant expansion, thinning and partially dehiscent. Apart from that, if we go ahead to the buccal cortex, it exhibits expansion, thinning, and you can say focal dehiscence is there with respect to the buccal cortex as well. Now, apart from expansion, if I talk about the effect of this lesion on the adjacent structures, that is the anatomical structures as well as on the teeth. So here the mandibular canal is not traceable as it is involved within the defect. Moreover, the teeth that is 4-6 and 4-7, the root apices are appearing blunt, suggesting mild apical external resorption. So, if we take into consideration all these features, that is significant expansion, then thinning of the cortices and dehiscence, involvement of the canal and the apical external resorption, we came to a radiographic differential diagnosis involving first to be unicystic ameloblastoma, second giant cell lesion, and third ABC, that is aneurysmal bone cyst. Now the patient further went for the biopsy where it came out, histopathological results came out to be ameloblastoma, and the treatment plan was considered, that is resection of this tumor further followed by the reconstruction plate. So in the next scan, I'll show you the post-operative scan whereby what were the results, post-operative results for this case. And here I have compiled up all the images so that you are able to see the cross-sectional, sagittal and axial in one screen. So it's more convenient. Thank you and stay tuned.